because it's a unique research space in terms of doing like the motion analysis type of assessments that we do here. There's no other place on campus that has the same, sort of level of motion analysis capabilities. And not all the studies use the same technology. I mean, I'll say that too. We have our full motion capture system. We also have the wireless electromyography EMG sensors that we use to measure muscle activation. We also have our wireless inertial sensors, which is basically a small sensor that has an accelerometer and a gyroscope in it. For some of the studies, we use all the systems all at the same time. For some of the other studies, we use one system only, or two, but not at the same time. So it just depends on the actual question we're trying to answer. For example, when we look at walking mechanics in say someone with multiple sclerosis, we only need 33 markers, because we only put the markers basically from their pelvis down to their toes. With those 33 markers, we can define how all the joints are moving, we can define how the thigh segment's moving, how the shank segment's moving. So we can do all that with 6 or 8 cameras. They're infrared cameras, so they actually don't see images the way that a digital video camera sees images. They actually emit an infrared light. That light is reflected off of the reflective markers, okay. And then the position of that marker is reflected back to the camera. So we can have 2 markers or we can have 100 markers. Each marker gets assigned its own XYZ position in space, and then we tell the software, what is that marker? Is it stuck on the knee? Is it stuck on the tip of their nose? Okay. Is it stuck on their hand? The cameras and the software don't define any of that. It's the user. And so that's where the flexibility with the technology comes in. There is a coolness factor. You just forget about it because you work in it so much. Even the graduate students, I remind myself and I remind them, like, the stuff we do is really cool. It's really cool.